Good afternoon, Stephanie. How are you?
Good. Thank you so much, Richard, for having me on.
I'm really happy that you're here today. I was so intrigued by your inquiry. You reached out to us, you wanted to talk to us about what you're doing, and I started reading more about it. And I was like, this is amazing. This is so cool and so impressive. And just, I think folks are going to find it particularly inspiring. So I'm so excited to talk to you. But just by way of introduction, hello, Stephanie Wang. You are a student
Mhm.
at Harvard University, right?
Yes.
But most interestingly, we're going to talk a lot of today about your creation, the Health Disparities think tank. But before we jump into that, can you kind of foundationally tell us about you, your journey, maybe what led you to molecular biology, what led you to health policy, what led you to Harvard? Before
Yeah.
we get into the Health Disparities think tank.
Yeah, absolutely, Richard. Thank you so much for having me. I'm super excited for this episode. But yeah, kind of like you mentioned, I'm Stephanie. I'm currently a rising junior at Harvard, and I study molecular biology with the secondary in global health and health policy.
Nice.
So I think my interest in biology and public health and kind of the intersection of the two started back in middle school, actually, when I was first introduced to the science Olympiad team in my middle school, which just so happened to be a really, really strong science Olympiad team.
That's
Um,
cool.
and yeah, so I joined a bunch of the life science events. I actually joined a bunch of other events as well, including some chemistry, physics events, but just the
Okay.
life science events spoke the most to me,
Sure.
including an event on epidemiology. And this was what
Oh,
really grabbed my attention.
yeah.
And what I really liked about it was that it seemed to be a combination of math, but also a lot of biology and also a
Mm,
lot of kind of sociology in a sense as well,
mm.
studying how humans behave. And so it was very interdisciplinary. Um, and through this event, I learned so much about this field. But one thing that I really struggled with was kind of digesting the hard concepts down into easier topics, since a lot of the textbooks that I was reading tended to focus on, you know, going super in depth. And it tended to be geared towards people who had already known a lot about this field. And so
Right, right. Not
it
for
was
beginners.
pretty,
Yeah,
yeah, exactly,
yeah,
not for beginners. So it
yeah.
was kind of hard for me to digest that material. And I had wished, maybe if there was something easier for me to read and easier for me to understand, that would be perfect.
Uh-huh.
But I never really had the motivation to like do that until COVID happened, when I realized there was a lot of misinformation surrounding the epidemic, a lot of uh,
Absolutely.
kind of issues that were starting from the root, which was misinformation.
Mhm.
And at that, I realized, maybe if I was to create something that would democratize epidemiology education
Mhm.
and make people better aware of public health and exactly maybe how this virus spreads, what is behind this epidemiology word, what does that even mean?
Yeah, what does it even mean?
How
Yeah.
exactly. So I basically sat down and I worked full time every day and put together this introductory epidemiology textbook. Um, and it was meant to be for beginners, and it was meant to simplify the concepts and make sure that everyone could understand it regardless of what level you were at. I made it on Canva. It was made with little graphics, and I got my younger brother to read it to make sure that it was understandable for
Good test
everyone.
audience.
Exactly, yeah. And so that was, I guess, my first entry into this world of health policy. It's not necessarily health policy and molecular
Right, but the
biology yet, but
beginnings, right? The first parts of
exactly.
your journey. Yeah.
Yeah, the very beginning started with this book. And after I self published it, I decided, why don't I use this opportunity to kind of make sure other people can get their
Mhm.
hands on this book? So I ended up reaching out to teachers who then began using my book as a curriculum supplement for their epidemiology classes. And then I ended up
At what
implementing
level,
one.
Stephanie? At the high school
This
level?
was
At the
um,
college?
this was middle school level,
Middle school level. Okay.
actually.
Yeah.
Yeah, and then I reached out to my teachers in high school, my biology teachers, and then they ended up adding an epidemiology kind of curriculum, a
Great.
lesson into their biology curriculum using my book as a reference as well. So it really kind of took off from there, and then I ended up going into this whole world of policy where I realized, we actually don't mandate or even encourage, in many ways, epidemiology or public health education in
Yeah,
schools.
absolutely not at
So,
all. Yeah. You have health class, right? But it's not
yeah.
necessarily always, at all maybe focused on public health or epidemiology, right?
Yeah, exactly.
Yeah.
So you don't really cover these topics that were very much
Yeah.
pertinent and prominent in the news
Right.
during the early days of COVID.
Yeah.
And that was
Yeah.
what I really wanted to get into the curriculum.
Yeah.
Um, but yeah, after that, I realized, genuinely, if we changed policy, then we can have such a better impact on society. And that's how I
Mm,
got interested in health policy. Um, and yeah, that kind of brought me to this whole world of how can I improve these social determinants of health to
mm,
improve public health at large.
mhm.
At the same time, I was also very interested in basic and translational science 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 like in the lab. That's kind of how I got my
Bench
first start.
science. Yeah. Yeah. Bench
Exactly,
science and
bench
thinking.
science.
Yeah. Yeah.
Yeah, and when I got to college, I began exploring that side of things as well in the lab, and then I began taking courses in molecular biology, uh, biochemistry. I took Orgo 1 and Orgo 2.
Oh, God
Um,
love you. My 2 least favorite classes.
yeah, that was rough. But at the same time, I also
I did
began
like playing
working.
with the models, though. That was fun.
Yeah, they were fun. They were kind of useless on the exams though. I
Yes,
realized
agreed.
you don't have time.
Yeah.
But yeah, I enjoyed learning a lot about those concepts. And then I also began working at a hospital. I worked out as a nursing assistant over at
Okay.
Mass Eye and Ear, which
Mhm.
is close by to Harvard.
Yeah.
And there was when I realized a lot of these disparities that I had previously only seen in the form of health information disparities were
Mm,
actually very, very widespread and prominent, and
yeah,
even in a hospital setting
sure.
that is supposedly a pretty well-resourced hospital setting.
Right, especially Mass
Um,
Pioneer because it's a highly specialized institution, right, in
yeah,
what it does.
exactly.
Yeah, yeah,
Yeah, and it's not just Mass on Air. It's basically every hospital in this
mm,
country. There are definitely disparities that you see
sure,
along racial lines, along geographic lines, along socioeconomic lines. Pretty much any type of disparity that you can think of. Honestly very much so manifests itself in the hospital. So
right,
when I was taking care of patients, for instance, who don't speak English, I was very much made aware of their challenges in terms of communication and how current interpretation services that we have don't necessarily um, aren't necessarily up to par, and they don't necessarily provide all the needed support that these patients need. So a lot of these disparities were for the first time unfolding in front of me, and as someone who wants to go into medicine in the future, this
okay,
was very shocking to me, and I didn't realize that we still had all of these disparities that we needed to
yeah,
address.
truly,
um,
truly,
exactly. So I realized, if I had all my classmates who are extremely brilliant and super smart people working on these topics and kind of exploring them at a further level, and so many of them would be interested in these topics as well. But if they just had a forum to come together in a
and
group
explore
and
them, right? Yeah,
exactly explore them, do research on them, do some in-depth literature review to see the gaps in the current healthcare system that we need to be addressing, and then couple that with policy action, that could just genuinely have such a transformative impact on healthcare systems at large. So that's kind of how the idea behind Health Disparities Think Tank came together. I guess that was a very long-winded answer to your question, but this is where we are today. So yeah.
I love, that your kind of explanation of your foundational journey took us right to the Health Disparities Think Tank because I can see how core it is, right? And the genesis and how you grew it and cultivated it through your own experiences writing your epidemiology book, what you said, like you said, working as a nursing assistant, getting interested in bench science, getting interested in how things work and come together. I will tell you my 2 favorite classes when I was a grad student were epidemiology and health policy.
Mm.
Those were my 2 favorite
Wow.
classes. And I will say this about epidemiology, I would often go back and reread the early chapters of the book because, to your point, like, you didn't get the foundational sort of explanations of what you
Hmm.
really needed to understand. It was kinda like jumping all the way, the very quickly because you have limited time, of course, right? But very
Mhm.
quickly we were jumping into full born, studies and looking at the
Yeah.
statistical sides of it and looking at the data and the analysis pieces of it. And I'd always want to go back and be like, wait a minute, can we like reset foundationally around what the core meaning of epidemiology is and what it's trying to accomplish, and before we get into like chi squared and all this other stuff,
Yeah.
and
Yeah.
same thing. But I was at a woman advancing health sort of sandbox accelerator contest a couple weeks ago at Mass General Brigham, I guess it's called
Mhm.
now.
Mhm.
And a couple of the statistics that I actually kept them on my phone because they were so shocking to me. Like a couple of the statistics we were talking about were, if you are a woman and you live on Beacon Hill or in the Back Bay
Mm.
neighborhood of Boston,
Mhm.
versus if you're a woman that lives in Roxbury, Massachusetts, which is just
Mhm.
2 miles away, your life expectancy is 23 years lower if you are a
Wow.
woman living in Roxbury than if you're a woman who lives in Beacon Hill. And for people who are listening who don't know the difference between Beacon Hill and Roxbury, it's what you think. Beacon Hill is a very affluent area. Roxbury is less affluent area, right? Even though they're only two
Mhm.
miles apart. But to have a 2 decade life expectancy differential between 2 miles, right? You just have to
Yeah.
say, Boston, be better, do better, right?
Yeah.
it and
Yeah.
so I think so many of what you're talking about in terms of health disparities is so very, very, very important. And you kind
Mhm.
of just talked for a second, Stephanie, about sort of the core mission of the health disparities think tank. Like you said, this place where students who are working on similar projects or wanted to have a place where they could come together, a platform that they could come together. But kind of what's the just distill it for us, Steph. What's the core mission of the Health Disparities Think Tank?
Yes, that's a great question. So, the core mission of the Health Disparities Think Tank is for young people to come together and do research in health disparities, but also to couple it with policy action. So,
Mm,
not only are your findings being publicized to the research community, but you're actively putting in the effort to make these recommendations and policy solutions known to those who work in policy and those who can genuinely make an impact.
great.
So combining those two elements of society essentially, and kind of marrying them together and ensuring that students get an enriching experience out of this entire
Mm,
program is kind of the core mission of what we're trying to do. And actually, there are very few spaces that I've seen that accomplish this, especially geared towards students.
right.
There are a lot of really, really great research groups doing extraordinarily impactful health disparities work out there.
Oh,
Um,
sure. Yeah.
but I feel like the actual amount of research geared towards undergraduates more so is very limited. And from my experience as an undergrad, whenever we think of research, we tend to think of bench research, and
Right.
that's incredibly exciting. I love my lab and everything, but it seems to be like health disparities work and research into these more social determinants of health are slightly limited in opportunities.
Sure. They happen
Um,
more at the graduate level, PhD level, so on and so
yeah,
forth. Right. Yeah, I agree.
exactly.
Yeah.
And it's not something that your mind immediately goes to when you think of science research.
Right.
So
Absolutely.
this is why I wanted to help students who maybe didn't even know where to start in terms of health
Mm,
disparities research. Maybe students who didn't even know that this existed.
right.
Provide them with a very, very intro friendly platform for them to meet other students who are also passionate in these topics, and work on projects that genuinely interest them. I also think that what we're doing is unique in that we are mostly student driven in
Hmm.
terms of topics and interests explored. So, for instance, as an undergrad, I would reach out. The traditional model would be I would reach out to different professors who are doing research in areas that I may be interested in. But ultimately, it's me having to meld my interests to whatever my professor's expertise is.
Yeah.
Whereas what we try to do is we try to collect information from students based on what they're interested in,
Yes.
and then meld the topics to their expertise and interests.
I was
Um,
gonna ask you how it works because
yeah.
it's very interesting to me because I know
Mhm.
that, like you said, they're working on very impactful projects, very specific to health disparities, but also you're coordinating 40 plus students, I think you told me,
Mhm.
50 students,
Yeah.
whatever the number is,
Yeah.
Not just at Harvard, by the way, right? This is
Hmm.
nationwide.
Exactly. Yeah.
So I'm very curious, Stephanie, how you manage and coordinate such a diverse group and just ensure like each project kind of gets what it needs.
Definitely. That's a
Yeah,
great question.
yeah,
So the way that we work is we first sent out applications to a bunch of different schools across the country, and we narrowed it down the pool. That was genuinely the hardest part about
yeah,
this
that,
whole thing was
yeah,
narrowing down the pool. And then, but before this, I had gotten in touch with a bunch of mentors at various hospitals across the country, but primarily hospitals in the Boston area, since that
mm,
was where I was most familiar with. And I reached out to a bunch of doctors, professors, uh, students, I mean, other medical students who could also help provide some mentorship, people who genuinely had a lot of expertise in the areas of health disparities. And we had a really, really great kind of interest from this population. Um, and we had so many mentors who were interested in working with us, and more so than I initially expected, actually. Um, and then after that, I looked at the mentors' interests, but I also primarily looked at the students' interests,
yeah, sure.
and and went back to the mentors and asked for advice on what are some promising project ideas for these particular questions or these particular areas that the students are interested
Hmm.
in.
Hmm.
And then I also went to some other, like some of my own professors that I'd previously worked with, who weren't affiliated with HDTT, and I had asked them also for some advice on potential projects that the students could be exploring. But this was very much grounded in the list of interests that the students had given me.
Right.
And then once the students were accepted, we matched them, we allowed them to rank which projects that they wanted, but then once they were actually assigned to their groups, they could always meld the project accordingly to whatever their group's interests were. So if
Wow.
we had
It's a
told
lot of
them
freedom. Yeah.
exactly, so we
Yeah.
want them to really explore what they want to explore, because a lot of the times health disparities work is very much rooted in your own personal identity.
Mm,
Perhaps as an Asian American, I am more so inclined to do research and explore disparities impacting Asian Americans.
right.
And I'm especially interested in looking into cancer outcomes among Asian American
Mm,
immigrants as well.
interesting.
Um, so I also know that a similar experience must be the case for many of these students joining. They also have kind of demographic based interests as well. And
Right.
so we want to make sure that we're respecting those interests. So after this whole project matching happens, we give them a few weeks to do the literature review and write up their paper, and then they get advice from their mentors, who then help them refine everything and provide them guidance on how this work can be improved. And then we also support them in submitting their work to various publications if they're interested in that. And we also are in the works of creating our own kind of HDTT journal where students
Oh, excellent.
can also publicize their work through
Have
our
our own
platform.
platform. Yeah, that's great.
Exactly. Yeah.
Yeah, one of the questions I kinda had for you, Stephanie, was to what end, right? So,
Hmm.
what are the end goal results? What are the end goals and desired results, right, of some of these
Hmm.
projects? Is it publication, assuming it's a or potentially a policy change, or
Hmm.
I'm sure, part of what your teams do and working with their mentors is to define what the end result is here, right?
Hmm.
For whatever they're working on. Maybe the end result is just to get it published and generate some awareness. Maybe the end result is to try to get a policy change, to try to get it in front of the legislation, to try to get it in front of a local medical policy.
Hmm.
Can you talk a little bit, Stephanie, about how through the mentor process you kind of the teams figure out what they're the whole Simon Sinek, right, starting with the end in mind, like
Yeah.
where do they end up?
Exactly.
Yeah.
So that's a great question. And you kind of touched on actually some of the end goals of the program.
Mm,
So we have students always include policy solutions or recommendations for interventions as part of their paper. This
mm,
is basically a mandatory component of their paper. And
great.
that's kind of the whole point, right? You want to
Yeah,
find ways to alleviate these disparities.
sure,
And then
sure.
part of the action steps is one, to publish, but we also have a network of policy advisors affiliated with our organization who are very various stakeholders in different positions
Mm,
within the government or within nonprofits or people who or within, advocacy organizations who have kind of a better understanding of policy solutions. So the students at the end, they're able to present their work to one of these policy advisors, who then will be made aware of these are the different steps that the students wants us to take in this area, to help alleviate this disparity. And so perhaps they can then use that as a way to inform their future decision making. For example, we actually have a couple people in the House of Representatives who are our policy advisors. And so students, as part of their meetings, would find a list of legislation that they
Mm,
believe would help alleviate that disparity that they're looking into, and then tell the member of the House of Representatives, hey, these legislation we believe would directly alleviate, for instance, racial disparities in cancer
right.
outcomes, for one, and then ask the legislator potentially, what are your thoughts on this legislation, and just get them aware that these policy solutions are out there, and just propose new policy solutions in
Mhm.
the cases where there aren't existing legislation.
Stephanie, talk to me a little bit about, and I think we talked about this before when you and I met earlier. Um, the Health Disparities think tank is a 501(c)(3) corp at this point, or you have aspirations to be a 501(c)(3) corp. I think maybe folks will want to understand the, I guess, the independence of what you're doing. Like,
Hmm.
so you're a Harvard student, but this is not necessarily like tied into Harvard per se, right? This is,
Yeah,
yeah, talk a
yeah,
little bit about that so folks just kind of understand the structure, I guess. Maybe
yeah.
we should have
So
led with that, but I kind of just popped into, kind of just
yeah,
popped into my brain.
yeah, no,
Yeah,
that's definitely something we should touch on.
yeah,
Yes, this is not necessarily Harvard affiliated, although a significant proportion of our students are from Harvard.
makes sense. Yeah.
It's an independent organization. We're currently in the process of getting it either 501(c)(3) or C4
Okay.
registered.
Hmm.
We're in the works. That process takes a while, unfortunately.
Yeah, it
Um,
does.
but yeah, we're trying to get it, established and kind of recognized officially that way.
Right.
But yeah, students from any school, any kind of year in their research careers is welcome to apply and join.
When you think about, clearly you and I both spent a lot of time thinking about health disparities in the course of my, a little bit longer career than yours, but in your career as well. And we can certainly talk about the challenges that, that we're all trying to overcome when addressing health disparities. And I know your organization is doing great work to try to overcome them. But one of the things I know I'm interested in, Stephanie, is where are some of the challenges HDTT has faced?
Mhm.
And how have you found your way to navigate through some of those challenges?
Yeah, this is a very important topic to cover
Mm,
as well. I think honestly, one of the biggest challenges that we faced was having to say no to some of our
mm.
applicants.
Wow. Yeah.
Genuinely,
Always
that
hard to
was
let somebody down, right? Yeah.
exactly, and I read some of their applications, and they're so passionate. I can tell, and then we also interview most of our applicants as well, and so we
Sure.
can genuinely hear about what they're interested in and how they want to contribute to this organization. But
Right.
unfortunately, since we're kind of just starting up, we don't have as many resources as we want to
Mhm.
be able to support like 100 students, for instance.
Right.
Although that's one of our goals in the future is to
How do you prioritize,
expand.
right? Yeah.
Mhm.
Yeah. Yeah.
Exactly. So it was really, really tough, and all of the people on our board can attest to this, that to really narrow down the people that we kind of accepted into this
Mhm.
first group, um, and say no to the others who also
Sure.
demonstrated a lot of potential. So right now, one of our challenges is to increase our, for instance, funding, and then also increase the number of people associated with our board, increase kind of our mentor base and our policy advisor base, just so we can accommodate
That's great.
many, many, many more students. My goal is to have student be able to eventually have chapters in different schools, especially the schools where a lot of our students are currently from.
Mm. Mm.
And that would definitely require a lot more time, energy, resources, connections, things like that. But that is definitely something I'm committed to making happen, just because I remember how hard it was to
Yeah.
narrow down that pool.
It is so hard. I'll tell you a quick story. When I was towards the end of graduate school and getting ready to finish up graduate school, I was working for a program that was providing low cost health insurance to men and women who were
Mm.
fishermen.
Okay.
And as part of the eligibility criteria for the low cost health insurance, because most fishermen either didn't have health insurance at all, right? Fishermen or fisherwomen had
Mhm.
no health insurance at all, because at the time it wasn't a law like it is now. Or they had these very, very expensive, high deductible plans because they have very, very dangerous
Yeah.
jobs, right?
Yeah.
So they're high risk. And in order to qualify for this, you had to prove that 51% of your income came from fishing, because a lot of folks,
Mm.
they fish for the season and they do other things in the off season, right? They might work construction or wait tables or do whatever. And then, and it would break my heart every time someone would not make the 51%, cutoff,
Yeah.
right? And
Yeah.
especially when they were like 49% or
I
50,
see.
and you'd be
Yeah.
like, well, I can't approve you for this low cost health insurance because you only, derived 49% of your income last year from fishing, and
Mhm.
therefore you don't qualify. So I can
Yeah.
empathize with how hard it is when you have limited reach, because we had limited money to spend on this,
Exactly.
the
Yeah.
subsidy. So to know that you have to say no, right? You see these
Mhm.
impactful projects. In my case, I see these individuals who could really benefit from this, but you have to say no, right? And that is
Mhm.
probably the biggest challenge. So I appreciate that. Um,
Mhm.
as you've kind of worked through that, Stephanie, where have you found, I guess, sort of, your biggest supporters, your champions, the people who are in your corner?
Yeah, well, I have an amazing board for HDTT. I actually have all worked with every single board member previously through other clubs and other organizations
That's
at
great.
Harvard. And I just through those previous interactions, I can definitely attest to each and every one of their dedication and their work
Mhm.
ethic. And so I'm genuinely have such an easier job because I have people around me who can have a lot of diligence and work with a lot of passion.
Sure.
So they're probably my biggest support in terms of HDTT, but also we can't really function without the students who are putting in all the work
Right.
and
Yeah,
doing all the
absolutely.
projects and
Yeah.
super on top of deadlines. I feel like in my experience with clubs at Harvard, and especially since HGTT is an extracurricular, it can be
Right.
really easy to kind of slack off
Yeah, of course.
um,
Yeah, yeah.
because,
Again,
you
prioritization,
know,
right? You only so many hours in the day. Yeah.
yeah,
Yeah.
especially when you have
Yeah.
classes, and most of our students also have internships full
Right.
time.
Sure.
Yet like almost every single student is fully committed and is able to turn in such high quality work. And I'm just very, very impressed by that. So definitely them as well.
Yeah.
But definitely also our mentors, and our mentors provide a lot of great work. And this is not something that they're like necessarily compensated monetarily for. So they're
Right. Yeah.
genuinely
They're
just
they're doing it because they believe in it as well, right?
exactly, and they're
Yeah.
volunteering their time and their expertise, so definitely very, very appreciative as well.
You've got mentors from very prestigious institutions, as you've kind of before mentioned.
Mhm.
Talk to me a little bit about partnerships, Stephanie. Do you envision a time, maybe you already have them, or do you envision a time where it would be appropriate to bring in industry partnerships as part of this, whether it be,
Mm,
biopharma, medical device, anything like that, that potentially digital healthcare? Does that make
yeah.
sense at some point, do you think?
Oh, yeah, for sure. So we're already talking to some hospital partnerships, some
Mhm.
departments over at MGH, and
Mhm.
we're trying to reach out to other hospitals as well and other departmental contacts. But yes, I've previously hopped on a few calls with people who work in the pharma and biotech industries,
Mm,
and that's something that we definitely want to expand into in the future, especially if we work on projects related to R&D or R&D
sure.
effectiveness or potentially on clinical trial effectiveness. Those are all future topics that I envision us touching on. And definitely, I think it would be interesting to have both public and private partnerships with both hospitals and maybe more VC companies or later stage biotech companies.
Sure.
I think they could be incredible mentors as well. And I've had some great
Absolutely.
conversations with,
Yeah, I
uh,
mean, and I
yeah.
understand you walk a fine line, right? I mean, I years ago,
Mhm,
I worked on a public awareness campaign for sudden cardiac death that was funded by medical device, right?
mhm,
Because look, at the end of the day, if you are at high risk for sudden cardiac death, an implantable defibrillator or, or pacemaker could potentially save your life, right?
exactly. Yeah.
but obviously the medical device company wants to sell medical devices, right? So
Mhm.
there's an aspect to it's a fine line between,
Mhm.
you having public awareness campaigns that are focused on making sure people understand the risks associated with a certain thing, but also when it is funded by industry, there is a little bit sometimes of a trade-off around, industry is there to with the best of intentions, but they also
Yeah.
have profit goals that they need to make as well, right? So
Exactly. Yeah,
yeah,
I agree.
it
Yeah,
makes it
we kind of just going on that. We previously
yeah.
did a project on looking into the ways that we can lower the price of cancer drugs.
Mm,
It's a huge problem and also a
unbelievable
very
problem. Yeah.
hefty one that that isn't like many people have tried to solve this problem, right?
Right.
But it's just very complex. But in that process we did end up talking to some industry leaders who did also provide us their insight on these issues. And so, incorporating all of the different angles, from maybe advocacy groups, industry leaders, people, physicians who are directly working with patients who can't afford these drugs.
Mm,
We want to make sure that our research projects are kind of taking in all the different perspectives of a
that's
particular issue.
yeah, important. Very, very important. Are there any favorites of yours right now, Stephanie? So you've definitely got quite a few projects that have been put out there
Hmm.
with tremendous community impact, where your research and your advocacy has made a tangible difference. Any favorites that come to mind right now on success or however you'd like to position it?
Yeah, we have honestly, that's like picking a favorite child.
Yeah, I only have one child, so that's easy for me to do.
Okay, okay, yeah. Yeah, but, I would say one that really speaks to me right now is a project that we're doing on looking into disparities in cancer screening rates
Ah,
among Asian Americans. So Asian Americans actually have they have cancer is the leading cause of mortality among Asian
mm,
Americans, and, it's actually very stigmatized in many Asian cultures. A lot of the screening regimens and Western medicines, even just from my experience coming from an Asian American household, it's very much like there's a lot of distrust around this technology.
sure, sure.
And so as a result, you get a very low screening rates and some really high morbidity diseases among Asian Americans. And so this project is really seeking to examine what are the players
Mm.
that lead to these disparities, and maybe how can we
How can we
promote some
overcome them? Yeah,
exactly, and
yeah.
provide some culturally tailored solutions
Mm,
to alleviate those disparities. So that's one that I'm super invested in, and one that I'm
makes sense.
super excited to see what they come up with.
Well, and it's so interesting too because so much of when you say all politics is local, I believe that so much of medicine is cultural, right?
Hmm.
I've had the privilege throughout my career of working in clinics that have been specifically designed for certain immigrant populations. I've worked in refugee clinics over the course of my career, and just the way that you communicate, right, with
Hmm.
with folks who are, to your point, non-Western, and culturally what's
Hmm.
appropriate and how you position things and how you talk with folks about getting them to, like you say, trust you, build in a
Exactly. Yeah.
confidence in what you're doing. The way that we do things here in the States and in the West is sometimes so very direct, and
Yeah.
it's
Yeah.
very hard to challenge. It's a very difficult challenge to overcome, right?
Yeah, and
Yeah,
kind of just going off of that point,
yeah,
in a lot of Asian cultures, for instance, y really the healthcare decisions are very much deliberated with the family, whereas
sure.
in the US, we have a very patient-centered approach to that.
Hmm.
And even just these subtle nuances can make a world of difference for whether the patient truly trusts the
Yeah,
healthcare system.
right.
Um,
Absolutely.
and then maybe if you don't provide adequate interpretation services to maybe a language that's lesser spoken, how do you expect your patient to genuinely trust you as well? So these are
Absolutely.
all specific nuances that definitely propagate health disparities, but with HDTT, we're trying to look for ways that we can help address these issues.
Absolutely. Stephanie, what do you need right now? Folks who want to be involved, who want to support your initiatives. What is it that HDTT needs right now?
Yeah, so we're growing our student base, but also it would be super helpful for any interested physicians, any interested researchers, professors
Mm,
to contact us and serve as mentors and even serve as policy advisors, especially for those who are more so policy inclined, or have worked with different nonprofits or in the government tackling these issues, we'd love to have you on as policy advisors as well as we grow our student base. And we really want to ensure a really nice and small student to advisor ratio,
Right.
so,
That's
to
great.
use
Yeah.
the fancy language of education systems. But yeah, it would be great for us to learn more from different professionals in different fields of the healthcare system.
That's fabulous. Steph,
Mhm,
you mentioned at the beginning of the call that you are interested in med school. Sounds like you want to
mhm.
potentially go on to be a physician yourself. That'll be a lot of work,
Oh,
clearly.
yeah, for sure.
HDTT will have to find a way to
Mhm,
continue to sustain itself,
mhm.
to be scalable, right? How do you envision that happening? You mentioned that you have a board. Do you have other members of an executive team that help you out along with this? Is like, when you think about just like again the sort of repeatability, sustainability, and sort of scaling of what you're doing, how is
Mhm.
that going to work?
Yeah, so we are planning on doing seasonal promotions
Mm.
essentially. So if you are a research fellow, you can have the opportunity to lead the team in the future. If you're currently a board member, in the future, you'll probably have the opportunity to kind of lead the organization.
So it's like a
S
promotional, yeah.
Exactly.
Mm,
I find that that system is probably the best in terms of incentivizing students to really be engaged with the organization. And like
mm,
you mentioned, right, I do have full intentions of kind of passing on the organization to another person,
mm.
when I'm older, when I
Yeah,
leave college. So that I want to make sure that the organization, even beyond me, stays true to its mission and true
nice.
to its ability to recruit and retain more students. So definitely that's something that's on my radar. And we have a system that's currently being developed, basically almost done, to configure promotions every single season.
I love that because I mean, look, you're gonna stand on those folks are gonna stand on your shoulders, and then
Mhm.
their shoulders and their shoulder, and that's how you're going to build right that
Yeah,
legacy, right, if you
exactly.
will. And it'll be amazing for you to look back 15 years from now and see the legacy, right, of what's
Exactly.
been built and how it's scaled, and hopefully you've got hundreds of mentors and
Mhm.
thousands of students,
Oh
right, that
yeah,
are
that would be
involved in
the
that.
dream. Yeah, for sure.
That would be the absolute dream.
Mhm.
Stephanie Wang, the organization is the Health Disparities Think Tank, hdtt.org for more information. Anything else that we want to make sure we get across? Can folks still buy your book? Can we plug your book? Where's that
Yeah, if
available?
you want the book, it's a little bit it was written 4 years ago, so
That's
not sure
okay.
how super, especially the COVID stuff, not super pertinent, but everything else, if you're interested in learning about epidemiology, if you're
Yeah.
interested in looking at cute little graphics of kids and, adults talking about diseases, feel free to look into Epidemiology Unmasked. It's available on Amazon.
Epidemiology Unmasked, Amazon, the wonderful. Stephanie, thank you so much for taking some time today to teach us about the Health Disparities Think Tank, your journey, all the things that you have going on. Best of luck to you. Best of luck with the work that you are doing. It's very impactful. I feel very confident in the future that you are trying to build around, admonishing health disparities. So thank you for all that. And again, I hope to see HDTT just continue to grow and have this amazing legacy. So congratulations and keep at
Thank
it.
you so much, Richard. I really, really appreciate the chance to be on this podcast, and it was a pleasure.